I'm a pediatric occupational therapist. Let's talk about strabismus. Strabismus is an eye condition where one of your eyes is not working with the other to team correctly. So, as you can tell from my eyes, they're supposed to work together and be parallel with one another. So, if I look to the right, they both go right. If I look to the left, they both go left. As you can see in this picture, this is when there's a few different types when one of the eyes goes in a certain direction. I've evaluated a ton of kids for occupational therapy in school, and this is something that I look for because it can be a reason for learning difficulties, especially with handwriting because of the visual piece. So, what it can cause is double vision. I worked with a student who used to we shared a room with the PT and the speech, and he would sit at the OT table and look across the room and tell me that he used to see two of his friends, which is one of his friends, which is double vision. Headaches happen often as well. I look for this in a visual screening that I do, where the child basically, I go in a bunch of different directions and the child has to track something with their eyes, and then I can tell if something's going on. When I do see this, I refer to a developmental optometrist because they can actually do vision therapy and work to correct this. It is due to the muscles in the eye. So you have a bunch of muscles that help the eye to move around. They're little tiny muscles, and that's what the vision therapists do. Some other treatment options are surgery in some cases, different types of glasses, and they can also do patching where they put a patch over the stronger eye so the weaker eye has to work harder, and then it will basically catch up. I recommend, if your child has this, to do whichever treatment method your doctor recommends. Get a couple opinions, of course, but there can be different extents to this. So that's why it's important to talk to your doctor. And if an occupational therapist told you this is going on, give them a big thank you.